Assalamu alaikum students. Today's our tutorial's topic is erythrocyte sedimentation rate. As the lecture has been delivered to you by Sir Tokir, so we are gonna quickly revise this topic and review the whole procedure. So the objectives of the topic are to understand what is erythrocyte sedimentation rate is basically, and what is the principle of this test, and how to perform the test, what are the methods commonly used for this test, and what is the clinical significance, the factors affecting the test, and what could be the sources of errors in this test. ESR, erythrocyte sedimentation rate, as the name of the test suggests, that it's the speed at which the red blood cells, mean erythrocytes, will settle down at the bottom of a test tube. And the test is called as a non-specific test. And its reason is because the test is not specific for some certain disease, for some specific disease, but it can be affected, raised or decreased in many kind of conditions. Some general conditions are mentioned here, like inflammatory condition. Most commonly, ESR is raised in inflammation or any degenerative changes occurring in your body, or the malignant condition like tumor or cancerous conditions. The any kind of changes in your body that is disturbing the plasma protein content, like fibrinogen, the most affected one when the ESR is uh, increased or decreased, and C-reactive proteins and many other plasma proteins. So ESR is a non-specific test, but it can be an indication of medical conditions or the changes in your body, which can be helpful in the diagnosis of some certain disease. So the principle of the test is that when the blood is mixed with anticoagulant and then it is allowed to stand vertically in a tube, so at which speed the red cells will be settling down is the known as the erythrocyte sedimentation rate. The rate at which the erythrocytes or the red blood cells are settling at the bottom of the tube. To perform the test, there are two commonly used methods. One is Westergren method, the other one is Wintrob's method. And nowadays, many automated instruments have been also used to perform the test, and obviously they take less time and quick results and many other benefits which we will discuss in the lecture. Westergren method. In this method, you should have Westergren tubes, which are very specific tubes for this method. These are the test tubes which has a length of 30 centimeter and they are graduated from 0 to 200 millimeter, and the diameter is should not be less than 2.5 mm, and these tubes are open from both ends. The tube stand should be there to place the tubes, and the blood sample and anticoagulant that is used in this test is trisodium citrate, and the timer, a watch to note the time for the test. In this slide, you can see the Westergren tube system. It's a tube stand, Westergren tube stand, and the Westergren tubes are placed in this. And this is how an ESR test is performed. To perform the test, the blood should be diluted with the anticoagulant, that is sodium citrate, in a ratio of 1:4. It does mean that if you are taking 1.6 ml of blood, then 0.4 ml of the sodium citrate should be added in that and mixed properly. Then mix the blood sample and to draw into the Westergren's tubes, the tubes I have shown into the previous slide. The blood will be sucked into those tubes by safe suction method. There are many instruments or the suckers which you can attach at the one end of the tip of the tube, and you can suck the blood to the 0 mm mark. And mouth suction should obviously not be used. It will be dangerous for the performer. And then when the blood is sucked into the tube should be vertically positioned in the stand, the Westergren stand, and there are some precautions we should apply on the test, like we should not place the stands or the tubes in any kind of area where there will be vibration, or that should not be exposed to direct sunlight. because these things will affect the results. And after placing the tubes in the stand, we will wait for 1 hour to settle. In this meantime, the red cells will be settled, and after 1 hour we will see that what is the exact reading of in the tubes. Normal values for men and women are different. For men, the normal ESR value is 3 to 7 mm after the end of 1 hour, and for women it's 5 to 9 millimeter at the end of 1 hour. So the second conventional method used for this test is Wintrob's method. For this method, the requirements are Wintrob's tubes, obviously, and in the specificities of these tubes are like it is 11 centimeter in length, graduated up to 10 centimeter, and it is closed from one end but open from the other. In the previous method, we have seen that the tubes were of 30 centimeter or 300 mm in length and graduated up to 200 mm mean 20 centimeter, and the tubes were open from both ends. But in this method, there is so much difference in the tubes characteristics, and its central diameter should be 2.5 mm. And other things we should have for this method are Winthrop tube stands, blood sample, anticoagulant. The main difference here is the anticoagulant also. Like in the previous method, the anticoagulant was sodium citrate, and anticoagulant used in this method is EDTA or oxalate we can use. And timer we should also have, obviously, to note the time. To perform the test, we will fill the Winthrop tube with EDTA blood up to 100 millimeter mark, the blood that is mixed with the EDTA anticoagulant, and by the help of the pipette or the tube suckers, place the tube in the stand exactly in vertical position. Vertical position is very important because if the position is not proper, then the results will be affected for 1 hour. After 1 hour, ESR can be, the reading can be taken from the tube, and the normal values for this test is different from for this method is different from the previous one. As you can see, the normal value for men is 0 to 7 millimeter per hour, and for women these are 0 to 15 millimeter per hour. As we discussed in the start of the lecture, that ESR is not a specific test. It is not diagnostic for any specific disease, but instead it will give you an indication that some problem is going on in your body, like inflammatory conditions. Inflammation is happening in your body, or like some infection is going on, some degenerative changes are occurring in your body. So there are some certain conditions in which ESR are increased, which are listed here, like chronic infections, anemia, multiple myeloma, septicemia, HIV. These are some diseases in which the ESR are increased. Osteomyelitis, bone inflammation, nephrotic syndrome, the kidney syndrome, burns. In burns, you can have increased ESR. Fractures, active syphilis is an infection. Post-operative states, after many operations, there are some inflammation or some and menstruation, pregnancy, malignancies. In these conditions, ESR can be raised. Systemic lupus erythematosus is also an autoimmune disorder and an inflammatory condition. Urinary tract infections, severe trauma, liver diseases, these all conditions can increase your ESR. And if the ESR is increased, you can go for some specific tests for all these conditions to rule out what's the reason behind the abnormality. Similarly, the conditions in which ESR is decreased is polycythemia, sickle cell anemia. In sickle cell anemia, the shapes of RBCs are disturbed. They become sickle-like. Because of that, ESR, the RBCs cannot settle down properly, or the rate is disturbed, that is decreased. DIC is the disseminated intravascular coagulation. Many allergic states, whooping cough, A-gamma globulinemia. Newborn infants. In all of these diseases or all of these conditions having plasma protein content changes, because of those, the ESR can be decreased. So we can also discuss about the stages in ESR, like in 1 hour what will happen in this test. In first 10 minutes, it is a period of aggregation, means Rolex formation like aggregation or aggregates or the stacks of the RBCs are formed at this stage, and the sedimentation is slow. But the next 40 minutes, the RBCs will be settling more quickly, and last 10 minutes is the packing of sedimentation red cells, mean they will be the final packing of the cells which have been settled down. There are many factors which can affect the test results, like many plasma proteins like albumin, globulins, or fibrinogen. These proteins can change the negative charge of RBCs, and because of that, ESR rate will be increased because negative charge will be preventing RBC settling down. And if the negative charge is disturbed, their settling down will be increased, and that will be a false result. Similarly, temperature, if the test is not performed on room temperature from 20 to 25 degrees Celsius, it will affect the results because due to high temperature, the viscosity of blood will be low, and and because of that, the sedimentation rate will be increased. Similarly, specific gravity and cholesterol estins also have the effect on the charge of RBCs. Viscosity, obviously, you can think if the blood is more viscous, the ESR rate will be decreases, and if the blood is less viscous, then the settlement will be increased. Shape and size of RBCs plays a very major role in the ESR. Like in sickle cell anemia, you can see that the shape of the RBCs are disturbed, so the rate is affected. And Rolex formation is the main key for the test of the principle of the test. So these all factors are interrelated and can disturb the results. So we should consider them when performing the test. Some precautions should be considered during performing the test, like the test should be done at room temperature at 20 to 25 degrees C because temperature alterations will affect the results. And test should be protected from direct sunlight because that will alter the temperature also. Test should be protected from vibrations because that will have a direct effect on the settlement of RBCs. And test should not be done with hemolyzed or clotted blood because in these kind of samples, the protein content is also already disturbed and the results will not be valid. Some sources which can cause errors in the test results are wrong volume of blood to anticoagulant, means if the proper quantity of the anticoagulant is not mixed with blood, that will cause false results. Blood not sufficiently mixed with anticoagulant, if you have proper quantities, proper ratio of both anticoagulant and blood, but you have not mixed them properly, that will also cause false results. If there are clots in the blood, air bubbles at the top of column, temperature is over the 25 degrees C, tube position is not properly placed, vertical position is not, then there will be some errors in the results. Vibration should be not at the bench where you are working, and dehydration also causes error in the results because dehydration will make blood viscous. So if the patient sample was taken when he was or she was dehydrated, then that will also cause a false results of ESR.